John's. My guest today in the studio is veterinarian Maggie Brown-Burry, and we're here to talk about your pet today, and your pet health questions are what we're chatting about. And feel free to pick up the phone, 722-7111, or long distance, 1-800-563-8255. And the next caller is on the line from Bay Roberts. It's Laura Tuck. Good afternoon. Thanks for calling in, and go right ahead, please.
Hi, nice to hear you guys today.
Thanks.
I have a question. It's not really a health question, but it's something that I'm trying to figure out how to
that's fine. Behavior questions, too.
Yeah. we got a coonhound, black and tan coonhound last year, so he's just a year old now, and we drove him back from North Carolina, and he was fine in the car, no problems. We got back here, and after about 2 months, all of a sudden, we'd put him in the car, and he would just drool. I mean, drool to the point of waterfall drool. And he never threw up and did any of that, but and didn't shake, just excessive amounts of drool. So I just stopped taking him because it was just a mess. And we just we basically took a break from the car for a while, and so I started just getting him in the car, shutting the door, or putting him in the back, shutting the door, giving him a treat, telling him he's good, and shaking the car a bit, and then letting him out. So I haven't really taken him on for another ride for a while, but we just got a puppy bloodhound. So I'm curious, is there anything, first off, I can do about the drool, because we do want to drive around the province more. And second of all, will having a second dog maybe ease that a bit with him, something to chat with in the back?
Yeah. So when you're putting him in and just like having him sit there and shaking the car, does he start any of the drooling then?
Nope. It's only when we drive, when we start moving. And like I said, he's not throwing up and he's not shaking. He's just sitting there, but the drool is just, and with the long ears and the shaking, it's just gross.
Yes. Yes. I love the hound dogs. I don't love them in my house for that reason.
He doesn't drool any other time.
Oh, perfect.
Not at all. Not at all. It's just purely in the car.
Yeah. So one of the challenges, and that can be sort of an attraction to veterinary medicine, but certainly can be a frustration in veterinary medicine, is that our patients can't talk.
Right.
So you can't ask him, why are you drooling? Do you have anxiety about the car, or are you nauseated? Even though he's not vomiting, he could be nauseated.
Okay.
Because drooling is a big sign of nausea in our dogs.
Okay.
So what I would suggest is get a checkup with your veterinarian. There are motion sickness medications for dogs.
Okay.
So there are options, and even if you just do it as a trial, does this help with the drooling? And it does, well, there's your answer. He was nauseated.
Okay.
If it doesn't help, there are, we don't necessarily need to grab a sedative, but there are supplements that can help kind of ease the tension, as it were. So I would definitely, from what you're describing, that excessive amount of drooling, I think it would be beneficial to chat with your veterinarian about trying a couple things to kind of pinpoint, is this nausea or is this anxiety?
Okay.
And
now,
then,
can you use Gravol? Sorry, I didn't mean to.
Oh, no, that's fine.
Is Gravol okay to use for a dog? A friend of mine has tried that, and I just want to make sure that is.
Yeah, and it's not wrong to try. There was a time when that was what we always recommended.
Okay.
But at that time, we didn't have any proven products.
Okay.
So I would recommend chatting with your veterinarian about the medications that are designed for dogs.
Okay.
If they work, and you can say, okay, this is definitely car sickness, then maybe try Gravol afterwards and see if it gets you the same effect. I would hate for you to try the Gravol, have it not work, and it be because your dog's not processing it properly, not because he isn't nauseated.
Gotcha. Yeah, that makes sense. Okay, now, would having another dog help at all if it's anxiety?
It might, if it's anxiety. Give him a distraction.
Yeah. Okay. Well, we'll see how the little puppy. So far, the puppy's fine.
Yeah.
He's only a month old. So.
Oh my God, he must be so cute.
Oh, he's so wrinkly. It's hilarious. Got two wrinkly dogs. So.
Oh, great stuff,
okay,
Laura.
Thanks. I appreciate your help.
Yeah, thanks for calling.
Have a great day, guys.
You too.
Bye.
Thanks.
Take
Bye-bye.
care. Bye-bye. You're welcome. Laura Tuck calling from Bay Roberts. Crosstalk on CBC. Pet health is the topic for discussion with veterinarian Maggie Brown-Burry. 722-7111. Long distance, it's 1-800-563-8255. And that's what Robert did. He's calling from Lumsden this afternoon. How are things in Lumsden today, Robert?
Not too bad. It's a pretty rainy day. Wind's finally got a little break from the wind at least.
Oh, good. It's about time.
Yeah.
Yes. Because you're wide open there.
Oh, we're very wide open. I think we live where the wind is made.
All right, go right ahead with your question, Robert. Maggie's here.
Yep, I got a question for Maggie. I got a 10-year-old Shih Tzu, a guy going by the name Tanner. The last year, maybe year and a half, he's developed a little, I don't know if it's an allergic reaction or a bad habit. He's constantly scratching and mostly up around his we call it like his armpits, we'll say, his front legs. And he's constantly trying to chew on his back. He's licking and trying to chew quite a bit.
Okay. So dogs do get allergies. And again, I can't say for sure without examining Tanner and having my own eyes and hands on him to say that it is allergies, but it is a possibility. And they can be allergic to pretty much anything a person could be allergic to. So they can be allergic to grass, pollen, dust, and then, of course, food allergies are a thing that we will see in dogs. Now, the itchiness you're describing, where it is on his body, would make me more concerned about an environmental allergy, if it is allergies, because usually, if it's food allergies, it's our feet and our ears exclusively that are itchy. If my whole body is itchy, it might be the environment. The obvious things, too, we worry about is parasites. Fleas are a common one, and you can't always see them. We like to say that if you see one flea, you have thousands.
Okay.
So if you only have a few fleas, you might not spot them. So if he's not on any kind of regular parasite control.
No, he's not. No, we've had him to the vet. We usually go to Grand Falls with him at Mid-Island Veterinary Clinic. She examined his back, and we've tried flea dips, we've tried flea collars. He loves it outdoors in the summertime, especially.
Yeah.
I mean, he's the type of dog, he loves the heat. So usually you'll find him in the wintertime lying in front of the wood stove, summertime out on the front bridge, just lying back in the sun. But it's something that's happening. It's all year round. It's not season oriented. He's doing it all the time. I constantly check and make sure he didn't have any ticks. And the majority of the problem seems to be right in the middle of where his spinal cord is. The vet checked him, said there's nothing wrong.
Yeah.
Physically nothing wrong.
Yeah. So I would be watching him also for any other kind of changes in how much he's eating and drinking, either increases or decreases, and the quality of his hair coat, by which I mean, like, does it look like it's getting thinner? Does it look like he's losing more hair? Because even if his skin itself looks normal, if he has, just seems like he has less hair. Other things that can cause dogs to be itchy are endocrine disorders, so diseases that are changing their hormones.
Okay.
And those can be a little bit more subtle to sort of sort out on physical exam. So if they're not finding anything on physical exam and you're still noticing a problem, the next step might be to do some blood work.
Now, he's had blood work done again or something?
Yeah. I mean, it's tricky. In veterinary medicine, a general practitioner is a dermatologist, a cardiologist, a surgeon. You know, they have to wear many, many hats. And sometimes there's going to be sort of more subtle or complicated problems that are difficult to get to the bottom to because it's not what they deal with all day, every day. So if the itchiness is really not resolving, and again, your normal veterinarian may have already thought of this, may have already tried this, but I'm just putting out there, you know, what I would do if it was me. They can consult with a dermatologist. So there are
So if I wanted to try them, like say, I know like my daughter has seasonal allergies. She takes like Claritin, Reactin. Would those kind of feel just a little tiny bit hurt my dog?
Those medications can be used in dogs, and there are appropriate dosages. I would recommend talking to your veterinarian because they'll have Tanner's file and history, and they'd be able to tell you exactly what dose would be safe for him.
Okay, perfect. He's I mean, as for his coat and his skin and stuff, I mean, like I say, he's 10 years old, but anybody who sees him thinks he's only about 2-year-old because he's so hyper and on the go, and everything is just like when he was young.
Perfect. Yeah, touch base with your veterinarian if you want to do a trial of allergy medications. They are used in dogs, but they'll have more history. They'll have that blood work in front of them. They'll be able to tell you a specific dose to try.
Okay, perfect.
All right, thank you very much, Robert. Good to hear from you, and have a great afternoon.
All right, thank you. I love your show.
Oh, I appreciate that, too. You're welcome, and have a great day. Bye-bye. That's Robert calling from Lumsden today, and thanks for calling in. And, of course, we've got about 10 minutes left, and my guest is veterinarian Maggie Brown-Burry, and we're here today to answer your pet questions. The next caller is on the line from Mount Pearl. I should mention the numbers, 722-7111, or long distance, 1-800-563-8255. And the next caller is from Mount Pearl. It's Diane, and Diane, go right ahead.
Hi.
Yeah.
I was just listening to your show, and I don't know if I missed a part of it or not, but I have a question. I have two dogs.
Yes.
One is a terrier, a full Yorkshire Terrier, and the other is a Shih Tzu Terrier mix.
Mm-hmm.
And the Shih Tzu Terrier mix loves to eat the other one's feces. Now,
Crazy dogs, eh?
Yes, and I mean, it's disgusting, and I don't know what to do. I try to keep as best an eye I can when they go outside, but not always possible. But is there some way I can break them from that, or?
So does he only like the other dog's poop?
No, he'll eat pretty well anyone's, but
Okay.
In the meantime now, we usually don't have him around too many other dogs.
Okay. So I don't know if you have mentioned this to your veterinarian at all yet, but there is sort of a food additive, this is going to sound ridiculous, that makes poop taste bad.
Oh, well, that's... yeah, no,
I mean, I think that poop tastes bad to begin with, but obviously your one little dog doesn't. So there is a food additive, and if he's not really around any other dog's feces except his own and your other dogs, you could just give it to both of them.
Okay, that's what I was wondering, because they both eat from the same bowl.
Yeah.
Yeah.
Yeah, so it makes I don't know if it makes it more bitter or what exactly, because I'm obviously not trying the poop myself, but it has been very successful in some dogs, and you just have to do it for a short period of time, and it kind of breaks them of the habit.
Oh, that's great to know. Thank you.
You're very welcome.
This sounds very helpful, Diane. I hope that works out for you and your dog.
I hope so.
You know, they're silly animals, aren't they?
They are, yes.
Oh, yes.
Thank
Take care.
you.
Okay, Diane, all the best. That's Diane calling from Mount Pearl. Phone lines are open. We've got 9 minutes to go. If you have a health-related question for your pet today, give us a call on Crosstalk 722-7111 or long distance 1-800-563-8255. Going through some of the comments on our Facebook page, someone's asking a question about a study at Tufts School of Veterinary at Davis. Now that's in Massachusetts.
Yes.
Having to do with dog foods.
Yes.
Suspect ingredients like potatoes.
So the study is looking at whether there's a nutritional link to dogs developing dilated cardiomyopathy, which is a heart disease. And basically it was a link that they started to suspect about a year ago. And so they initiated a study about a year ago, and now they're starting to get more information, and the nutritionist at Tufts is sort of releasing that information as she gathers it to help pet owners be able to do the best for their pets.
Right.
And basically the situation is, there's a lot of different factors at play. To try to keep it as simple as possible, there's a trend in the pet food world to go grain-free. And this is hugely a marketing thing. There hasn't been any real science suggesting that grain-free is better. So there's a huge marketing push that grain-free is healthier, and people believe that it's healthier, and so more and more pet food companies are going that direction, not because they have science to back it up, but because that's what the consumers are asking for.
Sure.
And just like anything that's kind of new, after a few years we start to say, oh wait, was that really the best thing? We're starting to see maybe some side effects or some developmental issues, long-term issues.
Yeah.
So dilated cardiomyopathy is a heart disease in dogs. There's certain breeds that it's common in, and we were starting to see it in breeds that it's not common in.
Such as?
Golden retrievers is the big one. And
what's the nature of that disease? What does it do?
The heart's enlarged, and the muscles are affected.
Okay.
And ultimately can be fatal. So you ideally don't want that to happen. Way back, years and years ago, there was no cat food, dog food. There was just pet food. And cats used to get a lot of dilated cardiomyopathy. And research found that it was because they had a taurine deficiency, and taurine is a specific amino acid. It was discovered that cats need a lot more of it than dogs do, and maybe it's not appropriate to have pet food, and therefore we started having cat food versus dog food. So that was one of the things they looked at when they started seeing more dilated cardiomyopathy in dogs. And some of these, what we're calling boutique diets, by which we mean they're using exotic ingredients like lentils or chickpeas, kangaroo meat, like things that we're not usually using. They are maybe deficient in taurine for some of these dogs.
I see.
Or the combination of ingredients makes it harder for you to digest or process certain ingredients, because there's a whole science around food. And we know certain medications shouldn't be taken, like you shouldn't have grapefruit juice if you're taking birth control pills because it'll interact. So different ingredients can interact. And they are finding that with some of these golden retrievers, it is a taurine deficiency that's causing that dilated cardiomyopathy.
So what's a pet owner to do in light of this research? Well,
if you feel strongly that you need to be feeding grain-free or these sort of more exotic diets, keep an eye on the research to make sure that you're avoiding certain ingredients. Like I think lentils is a big one to stay away from. Talking to your veterinarian, if you notice that you've always been feeding these kinds of diets and your dog maybe has low energy or isn't very tolerant of a lot of activities, having them checked out for heart disease. There's no sign on the outside of a dog that says, hi, my heart's a problem, and a dog might not tell you, oh, I got a bit of a chest pain. The way as a veterinarian we get the clue is either we're listening to their chest and we hear a murmur, or we take an x-ray and we see an enlarged heart. Unfortunately, from an owner standpoint, a lot of the time, if they haven't been getting those regular checkups, we haven't been listening to the heart with a stethoscope, they don't know there's an underlying heart disease until the dog starts to show heart failure. And then at that point, we can't back up the clock.
Interesting stuff. I'm going to squeeze in another listener here, Maggie, before we call this a show. It's a gentleman from Grand Falls, Windsor. It's Sherman. Sherman is on the line. And Sherman, thanks for calling in. Go right ahead with your question.
Yes, good afternoon. I'm enjoying your show immensely, by the way.
Excellent. Thank you.
We had a mixed breed female. She's approximately 24 pounds. And twice in the last 12 months, she developed this, it's almost like an injury down around her rectum. And first time it happened, I thought it was an insect bite of some sort. And it lasted for about 3 or 4 days. It's pretty raw, but then again, that's been maybe where she's licking at it. And we try to keep her from licking at it too much. And all we do is just put polysporin on it. And after 3 or 4 days, it just seems like it disappears again, just as fast as it showed up. And again, it happened, that was in late spring. And again, it happened again now about 1 month ago. And she's not an outdoor dog a big lot. She just goes out to do her business, basically, and she's in the house 80% of the time. And somebody suggested to me that it may be allergy related. So I just want to get your opinion on that.
Okay, thanks, Sherman. So, as usual, I can't really diagnose anything without seeing it, especially things on the skin. But from your description, it doesn't really sound like an allergy situation to me, especially if it's popping up in the same spot. How old is she?
She'll be 4 years old December.
Okay. And is she spayed?
Yes, she's done.
Okay. And the reason I ask that is sometimes in our intact females there can be sort of hormone situations going on, just where it happened kind of in the spring and now it's happening again now. That could be connected with a cycle, but if she's spayed, it shouldn't be. Has she had a vet look at it when it pops up?
No, because it's just like this. It happened the one time, and then the second time it happened, like I said, like 2 or 3 days later, it sort of heals itself. As long as like overnight, it's gone.
Yeah. So what I would recommend, like I said, it doesn't sound like allergies to me. What I would recommend is if it pops up again, if it's possible to have a vet check it out while it's there, they might be able to give you a little bit more information. there are some lumps that pop up on dogs that do resolve on their own that are completely benign, and she is in the right age group for that. But without seeing the lump, I can't really say that that's what it is. Your other option too would be to get a picture of it. And then when you go in for your annual checkup, you can say, hey, this lump keeps coming and going. Should I be worried about it? What should I do about it?
Oh, that's a good idea. Yeah, send her out of there, get a picture.
Yeah.
Yeah. Okay, then.
All right.
Great, Sherman. Thanks for calling in. It was good to hear from you today.
Yes, and thank you for taking my call. It's a great show, as I said before.
Excellent.
Have a great day.
You have a nice day too, Sherman. Take care. That's Sherman calling from Grand Falls, Windsor. 55 minutes went by just like that. Maggie Brownbury, we're looking at 30 seconds. I was going to ask you about festive seasons. You know, Christmas is coming, Halloween. I guess this is the time that can be harmful to pets too.
Just keep in mind, dogs will eat anything, including poop. So keep everything at a reach and keep your pets supervised around Christmas decorations.
Excellent. Thank you. And thanks for coming in today. Veterinarian Maggie Brownbury. Thanks for listening to the show. If you called in, we appreciate the phone call. And we'll see you back here, same time tomorrow.
This is CBC News for Newfoundland and Labrador. I'm Nancy Walsh. A man accused of carjacking and speeding yesterday appeared in court this morning.